Good morning, everyone, and welcome to today's webinar. Today we'll be talking about the value of pharmacy reviews. Our presenter today is Raisa Brostek, and Raisa's waiting in the wings ready to present. My name is Annie Sasson, and I will facilitate the webinar for us today. We begin all our programs with an acknowledgement. We acknowledge and pay respect to the traditional custodians, past and present, on whose lands we meet today. We acknowledge the deep feelings of attachment and the relationship of Aboriginal people to country, and we respect the cultural authority of the elders in each community. Okay, I'd like to introduce you now to Raisa. Raisa is a clinical pharmacist at the Carbrini Hospital here in Melbourne. She has been practicing there for over 8 years and has a particular interest in the areas of neurology, nephrology, and I hope I've pronounced that correctly, the quality use of medicines and medication safety. Prior to working at the hospital pharmacy, Raisa was a manager of a retail pharmacy for several years. She is an accredited pharmacist and has conducted home medication reviews. Just a reminder that slide there is about informed choice, and we encourage all our participants to seek further advice to see the relevance of the information for their situation. And I can see there that Raisa's put on her camera. Thank you, Raisa. It's lovely to see your face. So I will hand over to you now, Raisa. I'll make you the presenter, so bear with me while I click a few buttons here.
Great, thank you everyone. So today I'll be talking about medications in MS, and as Annie has said, I'll be focusing on the value of pharmacy reviews. So just to start off with an overview, today I'll talk about home medication reviews. We'll look at a case study. We'll look at how your pharmacist can help, focusing on your adherence to medication, the cost of medicines, side effects, interactions, and how to store your medicines appropriately. We'll then finish off with a summary and then look at any questions you guys might have. So each year, more than 140,000 Australians have to go to hospital with problems caused by their medicine. In up to 69% of these cases, the problem can be avoided. Older people and those that are on a lot of medicines, so more than 5 a day, are especially at risk. A home medication review involves your GP and an accredited pharmacist of your choice. Your GP sets up the review by writing a referral to the pharmacist, and the pharmacist conducts the interview, preferably in the comfort of your own home, and then writes a report back to the GP. So a home medication review may involve showing you how to take your medicines correctly. So that could be injections or puffers, explaining why and when to take them. We would explain where they should be stored and what to expect when taking them. And we would note any problems that you should report to the GP. So who should have a home medication review? Home medication reviews are particularly useful for people who take more than 5 medicines a day, have recently spent time in hospital, are concerned about their medicines, or if there's any confusion about your medications, or those who don't always remember to take their medicines on time. In terms of the cost, the pharmacist review and report is paid for by the Australian government, so it wouldn't cost you anything. Your GP may bulk bill you or charge you for the actual GP appointment or consultation, as they normally do. So let's look at a case study. This is Mrs. Jones. She's 40 years old and she has relapsing remitting MS, diagnosed at age 35. She lives with her family and she works part-time. No allergies. Her current medications, this is the list that the GP gives us. And then when the pharmacist goes to see her for the home medication review, they find that she's also on these complementary medicines. So in addition to the prescription medicines she takes, she's also on iron, buscopan, fish oil, metamucil, and calcium, which the GP isn't aware of. Her current issues. Well, she has trouble remembering to take her medicines. She has poor adherence to interferon injections because she experiences a lot of bruising from the injections. She's prone to constipation. Her thyroid function tests are inconsistent. She takes a number of vitamins and complementary medicines. She has increasing weakness in her legs. She's worried about the cost of her medicines, and she would like information about antidepressants. So how would the pharmacist help Mrs. Jones? We would look at improving her adherence, improve symptom control, minimize side effects of her current medicines, like the bruising that she is experiencing from her interferon injection. We would educate the patient on alternative options and make recommendations to her GP or neurologist or any other specialist that she may have. We would check for interactions with her medicines, ensure medicines are stored correctly, ensure medications are taken correctly. We would look at decreasing her medication load because she's on quite a few medicines, and I wonder if all of those are appropriate. Explain the cost of her medications and educate on disease management and other treatment options. So in terms of storage of your medicines need to be stored away from heat and dampness because those conditions can damage most medicines. Don't store medicines in the bathroom or near a sink, and don't leave them in the car because that's somewhere that we can't control the temperature. It can get quite hot very quickly. Of course, always keep out of reach of children. Interactions. So interactions can be caused in many ways, but the most common are by the drug making your body absorb or get rid of a medicine slower or faster than usual. And this can mean that your usual dose is either too strong or not strong enough. Another interaction is if drugs are added together, 2 or more medicines when combined can give you too strong of an effect. And this can happen if you're taking 2 medicines that do similar things in your body. In terms of adherence to medications, so we would look at the importance of adherence and barriers to adherence. Some patients can be reluctant to take medications because there's an absence of symptoms. So a lot of people, if they're feeling good, that they're reluctant to take medications that are more preventative. They have a fear of needles. They're worried about the cost, and they're worried about the side effects. Some patients stop medicines because it doesn't actually make them feel any better, and that could be because there hasn't been enough time that you've taken the medication for, or it could be for another reason, of course, as well. The side effects are worse than the disease, which can happen, and some side effects do get better with time, whereas others are quite intolerable, and that's when we would look at switching medicines. Patients sometimes think that another medication might work better, and again, they're worried about costs. So
Raisa, if I could just interrupt for a second. There is we've experienced some audio issues, and I'm wondering if it's probably best if you switch off your webcam. That way it'll reduce the bandwidth usage. Yep, we can still see your slides fine.
Okay, and should I go back to the slide before? Was that okay?
There was a slight interruption, so perhaps if you can redo that one, that would be great.
No worries. So
Thank you.
No worries. I was talking about the barriers to adherence of medications. So some patients may be reluctant to take medications because there's an absence of symptoms. So if they're not feeling well, if they are feeling well, then they're reluctant to take a medicine that's more preventative of symptoms, which is quite common. Some patients have a fear of needles. They're worried about the cost or the side effects. Some patients stop taking their medicines because they're not feeling any better or the side effects are worse than the disease. They think that another drug might work better, or they, again, are worried about the cost. So Mrs. Jones has said that she has trouble remembering to take her medicine. So what options are available? Well, there are Webster packs that most pharmacists pack, most retail pharmacists pack at a small cost. What they are is a blister pack, and the pharmacist packs the medications that you take in the morning all in the one blister for the day, your lunchtime medications in another blister, and then the nighttime medicines. So that way you just need to remember to pop out the blister that's appropriate for the time of day and the day of the week, rather than having to remember which medication you have to take at what time, or whether you've taken it or not. So that's quite a handy service that pharmacies provide. Another option is for you to purchase a dosette box from the pharmacy and actually pack the medicines yourself for the week. Most people do that at the start of the week. And the benefit of that is that you do have control over what you're packing and which medications you're taking where, more so than what you would have if the pharmacy did it for you. There's also a medication diary that you can keep just to help you remember to take your medicines. And there are lots of apps now available. I've listed the NPS one there, which is particularly handy. I know that Chemist Warehouse have an app as well, which prompts you to take your medicines. So it sends an alert as to what medication you have to take, and it also sends an alarm when you have to take it. Another benefit of those, of say the Chemist Warehouse app, is that it also tells you when you're running out of repeats. So you know you can go to the doctor before your prescriptions run out. So that's quite handy, and it's free. So Mrs. Jones has poor adherence to her interferon because she doesn't like taking her injections. So a lot of the times the bruising that Mrs. Jones is experiencing is because of incorrect injection technique. So we would provide her education on the correct injection technique. We've got a lot of sort of dummy injections that we can use. We could also speak to her neurologist about alternative treatments. So there are a number of different interferons available, luckily, which all have different ways of injections, or methods of injection. So we could recommend switching to an alternative interferon, or we could switch to an oral agent, or switch to an intravenous agent. Now, Mrs. Jones has said that she is prone to constipation. Constipation is one of the most common problems in MS, and fecal urgency and incontinence can also occur. Looking at all the medicines she takes, the ones in red are the ones that commonly cause constipation. So you can see Mrs. Jones is on quite a few medicines that cause constipation. Her oxybutynin, which she has for her bladder, her baclofen for spasms, and pregabalin for nerve pain. All of those prescription medications can cause constipation, as well as the complementary medicines that she's on: iron, buscopan, calcium. Even the Metamucil, if you have too much of it, can be constipating. So when we look at treating constipation, we start off with non-drug measures, then we look at fibre supplements, then we look at osmotic laxatives, and lastly, the stimulant laxatives are the strongest, but usually they're also the most effective. In terms of non-drug measures, so normal stool habits vary widely between individuals, and the timing of bowel motions should be as regular as possible. The colon moves most after a meal, and this is the best time to try. We recommend that you avoid postponing if the urge arises, and we recommend an increase in dietary fibre, about 30 grams a day from cereals, grains, fruits, and vegetables. You don't want to have too much fibre though. So when your fibre is more than your fluid intake, that's when you can run into problems with constipation. So it is important to have adequate fluid intake as well. And some people do reduce their fluid intake as a means of managing their bladder symptoms, so that's just something to be wary of. Whenever possible, we recommend that you increase mobility if possible. The bulking agents are things like Fibergel, Metamucil, and normal fibre. They increase the volume or bulk and consistency of the stool. They stimulate intestinal activity and speed transit of the stool. However, bloating and flatulence can occur as side effects, so that's why we don't want you to have too much of it. And again, we really emphasise keeping up the fluid intake when you're on these bulking agents. Osmotic laxatives work by drawing water into the bowel, so they are non-absorbable sugars that are fermented in the bowel. They can cause bloating and flatulence, and they're not always appropriate for patients with diabetes because they are made up of sugars. So those are things like lactulose or Movicol. Lastly, stimulant laxatives, as I mentioned, they're the strongest. So they stimulate the bowel wall to move. They're often combined with stool softeners such as DocuSafe. And the long-term use is not recommended unless under supervision, because you don't want your bowel to become reliant on these stimulant laxatives. So Mrs. Jones has said that her thyroid functions are inconsistent. So the first question we would ask is, how is your thyroxine being stored? Thyroxine does require refrigeration, although tablets can be kept out of the fridge for 21 days. For those of you that are on thyroxine, you know that it comes in a big box with about 100 tablets in it. So you can take the blister out of the one that you're using, but then keep the rest of the tablets in the fridge to make sure that the efficacy is kept up. Also, with thyroxine, you have to take it on an empty stomach, which means at least half an hour before food or 2 hours after. Also, it should not be taken within 2 hours of her calcium or iron tablets. So that's something important because calcium and iron does reduce the effectiveness of thyroxine. So like I just mentioned, some vitamins like iron and calcium with thyroxine can interact with prescription medications. So the calcium and iron supplements can inhibit the absorption of her thyroxine. They can also interfere with some antibiotics, so just something to be aware of if you do start an antibiotic. They can cause and worsen side effects like constipation. The fish oil that she's on can also increase bruising, which she has a side effect of her injection, but the fish oil can make it even worse. So always check with your pharmacist or doctor if you'd like to start a new supplement or any other medication to make sure that it doesn't interact with everything else that you're taking. I also wonder if she really needs these supplements. What are her iron and calcium levels? If they're within normal range, does she need to continue taking these? I've put a link there. The Sloan Kettering Herbal Medications Centre is a great resource to have if you want to look at what vitamins interact with prescription medications. Mrs. Jones has said that she also has weakness in her legs. So drugs to reduce daytime spasticity should be given in conjunction with physiotherapy. Spasticity may help to brace weakness of the legs. The nighttime doses won't interfere with daytime activity. And if she does want to reduce baclofen, it should be withdrawn slowly. So it's not a medication that you can stop taking abruptly. These are some other options that are available if the baclofen isn't appropriate. You can see they all have different side effects, but it's just about finding the one that's most appropriate for you. So in terms of the cost of medicines, in Australia, most medicines are covered by the PBS. If you're a general patient, you're usually spending about $41 per medication. For concession patients, the price this year is $6.60. There's also the safety net threshold. So if you're a general patient and you've spent over $1,400 for your prescription medications, it means you've reached the safety net. And that means that once you've reached the safety net, you only need to be paying the concession price cost per medicine, which is $6.60. If you're already a concession patient and you've spent just over $300 on your prescription medications, all of your medications will then become free. So they won't be at any cost to you, with some exceptions, of course. The best way to know if you've reached your safety net is to go to the same pharmacy each time, and that way they keep a track, they keep a tally of how much you've spent on your medicines. And once you've reached the limit, the safety net threshold, then they'll let you know that you've reached the threshold and they'll issue you a safety net card. If you go to different pharmacies or you've been to hospital, you'll need to keep a track of those, of how much you've spent on the medications yourself, just by asking for a printout from the pharmacies, which is easily done as well. But it's, I find that patients find that it's quite handy just to go to each pharmacy each time. And that way they also have a record of what medications you're on. So if there are any drug interactions, they can let you know and talk to you about them. So the safety net threshold includes medications for the partner or children under age of 16 and dependent full-time students. Another way of reducing cost is to consider generic medications which don't come with that brand price premium. Sometimes it's a matter of saving a few dollars per medicine. Other time the you'll be saving over $10 per medicine. So generics are always worth considering. I know that some people do get quite confused when it does come to switching to generic medications. So we always recommend that you look at the active ingredient, because that doesn't change. Whether you're taking paracetamol, it'll always say paracetamol on the box, regardless of what brand you use. So that's always best to look at the active ingredient rather than the brand name, which does change. In terms of antidepressant use in MS, so depression and anxiety can be common. It could be a reaction to the diagnosis or a reaction to physical consequences. It could be a result of effects on relationships or employment, or having to have adverse effects of medications, or directly due to the attack of demyelination. So luckily, the full range of antidepressants are appropriate in MS. There are some adverse effects that are more common, but most people will start on a lower dose and increase if required, and that will minimize the side effects. So in terms of for Mrs. Jones, what we would be suggesting to the doctor is to review her interferon to see if there's something more appropriate with less bruising. Repeat thyroxine levels in a month now that she knows to take it on an empty stomach and how to store it appropriately. We would perform her iron and calcium levels to make sure that she still needs to take those supplements. We would review the need for Lyrica because it is constipating. We would change her oxybutynin to morning daily dose only, and change her baclofen to nighttime only. So the suggestions we would make to Mrs. Jones is, like I said, to take her thyroxine on an empty stomach, to store it in a fridge, and to space it away from her iron and calcium supplements. We would educate her on ways to manage constipation and provide a correct injection technique for her interferon. We would recommend a dosette box or a medications app. We would talk to her about asking her pharmacist if she's reached the safety net to help reduce the costs of her medications. And we would speak to her doctor, like I said, regarding the baclofen, the oxybutynin, and the pregabalin. So in terms of medicines information, your doctor or the pharmacist is always a good point of call. Every medicine comes with a consumer medicines information. If it's not inside the box, certainly ask your pharmacist for a printout. The NPS and of course the MS Society are also great resources for information about your medicines. So to summarise, home medication reviews are a valuable service available to you. Your medications should be regularly reviewed. Check possible interactions with your pharmacist. Options available to assist with adherence include switching medications or using aids to remember to take medicines. And the safety net is in place to help with the cost. And now I'm happy to take any questions.
Thank you, Raisa. I've just checked the questions that have come through, and none have come through at this stage. So that's okay. What I might do is go through the final slides. So I'm just going to take control again, Raisa, from you. Yep. So bear with me while I do that. And in the meantime, if you do have a question, please type it in. And we will be happy to respond to that question. If there is something that comes up at a later time, or if we don't get to your question today, just letting you know that the MS Connect line is open, and that number is free call 1800 042 138, or feel free to email msconnect@ms.org.au. So I'll just go through our final slides. So just a word on the MS Connect line. There are many reasons to contact MS Connect. Those two pictures there are of our lovely MS Connectors who will take your call and field them. They talk about the treatment options, managing symptoms, information about your medications. So they're a vast field of knowledge, and they're able to refer you to other services that we have available here at MS. So one of those services is a peer support program, and it provides one-on-one phone support. We do have face-to-face sessions, but obviously in this current climate, they've been put on hold, and rather than face-to-face, they're doing telelinks and telegroups. So we do have the technology to keep everyone connected and able to chat with the peers and share views and opinions and support one another, which is great. The next slide talks about the Get Your Act Together tool, which is available on our website. And this is a tool that goes through the common symptoms of MS. You simply plug in all your information. It'll spit out some information back to you regarding your symptoms and a tailored program for you. So it is quite interactive and it's fairly easy to use. So you're most welcome to access that through our website. The employment support service, that is available through MS Connect as well. So if you are currently working and want to stay in your role, if you're struggling with your symptoms at work, you're welcome to contact MS Connect. We are a registered NDIS provider, and listed there on the screen are the support services that we assist with. And if this applies to you, My Aged Care, if you're 65 years or over, you can access information and further supports to meet your needs. So back to our questions. I'll just check and see what we've got here. Caroline has said, sorry she arrived late. That's absolutely fine, Caroline. She's just been diagnosed. Can you tell me about Bridging Med Tecfidera?
Oh, I can't actually. Let me just see what we've got on this.
So I think while Raisa's looking that up, the MS nurse advisor may be able to provide you with more information, Caroline, and you can contact her through the MS Connect number. So it's 1800 042138. And they should be able to provide information about that medication and the other medications that are prescribed for MS.
Is there a specific question about Tecfidera that she'd like to ask, or just trying to?
I think it's a general question, and given that she's just been newly diagnosed, I think maybe wanting to find out, side effects and things like that. Would that be correct, Caroline? So yeah, just a bit nervous about taking the medication. So of course, maybe looking at side effects and things like that. If you can assist Raisa, that would be great.
So Tecfidera is very well tolerated, and from everything we've seen with patients, that the side effect profile is quite reasonable when you compare it to other drugs. It's also been shown to be very effective as well at reducing relapsing MS treatment, so it's been well studied. It does have patient, I think a patient number that you call for support for people that are on it. So perhaps if you look up or perhaps get the nurse to give you the number for that. I'm not sure what it is off the top of my head, but I do know that they've got patient support available for patients that are on that medication. But yes, it's been shown to be effective, and and in terms of side effects, from what I've seen with patients, it is very, they are quite tolerable in comparison to others. There are a lot of patients are switching to Tecfidera from other medications. So yeah, that's, but definitely give the nurse a call, as well as NPS as well. They'll have a lot of information, as well as the support that's available from the drug company itself for patients that are on Tecfidera.
Okay, excellent. Thank you, Raisa. Julie's asking, she's currently on baclofen, and it doesn't seem to be helping her burning feet at night. She currently takes 25 milligram at night. Would it help her to take another one in the morning? The script said that she can do that, but is it too much? She's worried about side effects.
Yeah, look, and the more you take, the more there would be an increase in side effects. But some people, in terms of how much, you can tolerate. It depends, varies from person to person. So it's a matter of seeing if you are getting side effects by taking the nighttime dose, then no, an increase in that dose probably wouldn't be ideal. But if you're tolerating your nighttime dose well, and the doctor has said that you can take that additional morning dose to help manage your symptoms, then I would at least do a trial of doing that and seeing what happens. Because in terms of, there's no set dosage that everyone can tolerate. It's just a matter of how sensitive your body is to the medication.
Okay, great. And with regards to taking it at night, is it best to be taken an hour before bed?
Yeah, around half an hour to an hour. Yeah, before going to sleep. Yeah.
Okay, excellent. Thank you, Raisa. And I've just got a final question regarding coronavirus. Shiva Kumar is asking, would the lockdown affect pharmacies?
No, so pharmacies are deemed an essential service, so it will not affect pharmacies at all. In terms of getting your medications, a lot of pharmacies do offer a delivery service, and the ones that don't probably will start to now anyway. So that's just another way to get your medications to make sure that you don't run out. But otherwise, no, the pharmacies will be staying open.
Okay, that's good news. All right, no further questions have come through. So if you do think of something, or you still have a question to ask, please feel free to call MS Connect on free call 1800 042 138, or you can email them on that email address there. We are at the end of the webinar now. We've just got a few people saying thank you. Julie, Kim, Caroline, you're most welcome, everyone. It's great to have you join us for the webinar this morning. And I'd like to thank Raisa for providing the presentation to us. It's been great having you on board, Raisa. Thank you very much. So before we close the webinar, as I close the webinar, a short survey will appear on your screen. So it'll be really great if you can just let us know how we went today. It'll help us improve our services in the future. So big thanks to everyone. I hope you all stay safe and stay well, and we look forward to seeing you online for our next program. All the best. Bye for now.